Do you know someone who is easily distracted, struggles to sit still, or has difficulty with turn taking? You might know someone with ADHD. ADHD, or attention deficit hyperactivity disorder, is characterized by symptoms such as difficulty in organizing tasks or constantly feeling on the go. These symptoms can cause problems in work, school, or in relationships with others. However, the manifestation and severity of the symptoms can greatly differ between people and the diagnosis of ADHD. Therefore, many researchers believe that ADHD actually lies on a continuum. While there does not seem to be a singular cause, a combination of genetics and certain family dynamics seem to contribute to the development of ADHD. For example, a poor quality of interaction has been associated with ADHD. Studies looking at the brain found neurological differences in individuals with ADHD, specifically in the prefrontal cortex and the basal ganglia. In addition, problems with the neurotransmitter dopamine seem to play a prominent role. As a result, traditional approaches to minimize ADHD symptoms have often involved the use of medication. Stimulant drugs, such as Ritalin, increase dopamine in the brain, which usually results in improved concentration for several hours. However, to maintain these benefits, these medications must just be taken regularly. Nowadays, a lot of people get diagnosed with milder cases of ADHD, but yet the majority of people are still prescribed medications to treat their symptoms. Unfortunately, there is a lack of evidence for the long-term benefits of medication use. In addition, the prolonged use of medication may cause mental and physical side effects such as decreased appetite, cardiovascular problems, or perceived changes in personality. This is why some psychologists recommend that non-pharmacological treatments are used first. One non-pharmacological approach to treatment are psychotherapies. One of these is behavioral modification. Behavioral modification is one of the most effective psychological approaches for children. This intervention involves parents and carers and helps developing strategies to minimize the negative consequences of symptoms. Cognitive behavioral therapy, or CBT, may be particularly beneficial to adults with ADHD. It involves creating cognitive strategies and coping skills to reduce the impact of ADHD and related problems such as low mood or anxiety. Another pioneering approach is called neurofeedback training. During such a session, the individual brainwaves are measured while the patient receives real-time feedback. The goal is to learn to control particular brainwave patterns which help to manage ADHD symptoms. While early results are promising, this treatment is not widely available yet. In summary, ADHD is potentially a hugely impactful condition that is sometimes trivialized. It is maybe recommended that psychosocial treatments are tried first and medications are then tried later. But ultimately, treatments should reflect the person's individual needs, and the person's own information is the most important.